joined D.A.T.A about 5 years ago, hearing about it in one of Mum's magazines she saw. Thought it'd be interesting to go check out.
I joined D.A.T.A back in the 1980s after I discovered I was going into renal failure.
We've been members of D.A.T.A for around 15 years now actually, since I became the carer of Grant, who has end-stage kidney disease. D.A.T.A's helped us out quite a lot over those years with a number of financial grants, assistance and some education, as well as just providing a familiar environment for us where we can get together and have some social events and meet new people.
Hi, my name's Yvonne. About 25 years ago I was diagnosed with polycystic kidney disease. I went looking for education to tell me how I could slow down this progression of the disease.
Back 23 years ago, we had stomach problems and didn't know what it was, in pain. So I went to the Box Hill Hospital and got diagnosed with kidney failure. When I got the offer, I got straight on dialysis, having blood tests, blood and CT scans and ultrasounds and X-rays, everything.
Diagnosis was quite a shock and I didn't know how I would cope with working. So I went on to peritoneal dialysis, which meant I could keep working.
And I was born with kidney disease and I've been on dialysis for about 20 years now. I've had 2 transplants and through that time I've been supported by D.A.T.A on numerous occasions, and I'm on dialysis, hemodialysis at the moment, waiting for my 3rd transplant hopefully one day.
Joining D.A.T.A, all these events started happening and going out to all these dinners and lunches and events. Been great. D.A.T.A's been great.
D.A.T.A is made up of volunteers, people who have renal disease, who are on dialysis, and their family and friends. I've recently spent some time in hospital in the renal ward, and most of the patients are diabetic. And I think it's important that people realise diabetes is the main cause of renal disease.
I became a member of the Dialysis and Transplant Association of Victoria about 10 years ago. This is a group of volunteers, all either impacted by chronic kidney disease, had a transplant or on dialysis, and their families, friends and carers. D.A.T.A supports people with chronic kidney disease in many ways. They have 2 holiday houses in Victoria where people can go and dialyse in those holiday houses. They sponsor education awards, they provide a lot of support and camaraderie, social events for those impacted by chronic kidney disease. In 2017 I founded Filter Your Future. I developed an education program which I titled the Healthy Kidneys Education Project. This project visited schools in Victoria, mainly in Melbourne, and it was an all-singing, dancing show so that children would have fun while they were learning about the importance of keeping their kidneys healthy.
One of the things that I value most about D.A.T.A is their sponsorship of Filter Your Future. As both a clinician, registered nurse and a lecturer in nursing, I know the importance of educating the future of society around healthy kidneys, and the Healthy Kidneys Education Project is really vital in making sure that Australia doesn't progress to end-stage kidney disease and that we avoid the toll on not only society and community, the health system, but also individuals and their families. And I know firsthand from caring for Grant the impact that chronic kidney disease can have, and these programs are absolutely vital in making sure that not everyone has to go through that.
D.A.T.A's been sponsoring the Healthy Kidney Education Program since 2017.
Throughout the program I've evaluated feedback from students and teachers, and there's very strong evidence that these lessons are having a great impact. Teachers and children are telling us that they are changing their lifestyle and that they are avoiding sugary drinks and trying to have less processed foods and having a much healthier diet containing more fruit and vegetables and drinking lots of water for healthier kidneys.
So it's important to educate the children into good eating and drinking habits so when they become adults they don't go into renal failure.
The Healthy Kidneys Education Project now provides lessons for teachers from foundation or kindergarten through to grade 6 in primary school. The lessons are aligned to Australian and New Zealand curriculum and are also aligned with the United Nations Sustainable Development Goal 3 for good health and wellbeing. D.A.T.A has funded the costs of developing these online lessons. When you consider the cost of dialysis or a kidney transplant and compare that with the potential future costs saved and the benefit for our community for having less people being terribly burdened by chronic kidney disease, those future costs saved are going to be in the millions of dollars. I've had a lot of fun creating Filter Your Future and making silly songs such as Damien the Dialysis Dude, named after my cousin Damien, who's on dialysis in Sydney. I've really enjoyed creating this education so that children will be engaged by the lessons and that teachers will feel inspired to teach the lessons. On World Kidney Day, I joined with members of D.A.T.A to encourage and strive to continue educating our young children so that future generations will not be burdened by chronic kidney disease.